Go.
Oh, I.
Hi, welcome to Naptime Nutrition. I'm Yaffi Lvova, registered dietitian nutritionist and owner of Baby Bloom Nutrition and Toddler Test Kitchen. And today I am thrilled to have the fabulous Dr. Jordan Virden, pediatric dentist, and we're going to talk about the super contentious topic of sugar and cavities and pediatric health in general. So thank you so much for joining me, Dr. Virden.
Thank you so much for having me. Very excited to be here with you today.
I'm excited to have you. So we actually connected in a Facebook group that I help moderate with Dani Leibovitz, who I plug her books all the time. She's super fantastic. But we were talking about sugar and cavities. And I've been wanting to interview a pediatric dentist for a while because since we were kids, since our parents were kids, and probably since their parents were kids, we have these specific ideas about pediatric oral health, and science changes and medicine changes, and somehow these ideas just keep getting perpetuated from one generation to the next. So it's time for a reboot. It's time for an update on what really is the deal with pediatric oral hygiene.
Yes,
Yeah.
I agree. It's time to, update things and kind of do things that make sense for not only children, but their parents and caregivers as well. So happy to talk about that with you.
Yeah, well, it's always good to help update the public on what's the actual science behind what we're doing with our daily lives. And the thing with oral hygiene is that this is this is a more than daily thing. This is a twice daily thing or more. So it's important to have the right information.
I agree. I definitely agree since we're supposed to be brushing and everything taken care of multiple times a day. Best to know best practices.
Yes, yeah, and of course, just to be a little fun, I'm not so on top of New Year's resolutions, but my last New Year's resolution, the beginning of 2020, was to floss every day, and so I achieved that.
Yay! That's exciting.
Yeah,
That's a good
so
one.
yeah, so a lot of people make some kind of weird New Year's resolutions, and especially New Year's resolutions that relate to health. And I thought this was a really good one because, it's backed by science, unlike, well, we won't get into the whole dieting thing, but let's start with a basic one. When should kids first visit the dentist?
So I like to think of the first what's called a dental home. And I think in pediatric dentistry, that's so important because we see children from, little babies under a year or even younger than that, all the way up until, in our practice, at least until they're done with college. So, that whole span is so important. So I think the first visit, I like to tell parents, as they're comfortable, first tooth or first birthday, just because, in that visit, they may not have a lot of teeth. Maybe they just have the two on the bottom or just one on the bottom. But I think it's important to, one, get the child used to coming to the dentist and all of the dental things so that they're comfortable. But also for parents and caregivers to ask questions, like positioning for brushing, how to avoid or what to do if, their baby or their toddler, as they get more active, bumps their teeth or has a fall, what toothpaste to use, and all of those different things, I think, are really important conversations to have. And we want to be a place where parents and caregivers can feel, safe asking questions or confident asking questions and don't have to wonder. And also, I think it helps to set children up for a lifetime of good oral health because they don't have fear of dentistry, that it's somewhere that they've gone, something that's routine. So I think starting early is good. I know with COVID, it's been a little bit difficult to have those first visits early. And when we were closed, did some virtual visits. And I know a lot of dentists still do the virtual visits. So it's just, there's a way to make it work as parents and caregivers are comfortable.
I think that's a great way to look at it because sometimes it's not about the direct health, but about the feeling around the health, about that comfort.
Mhm.
And it actually came up in a mommy Facebook group yesterday that I'm involved with, where the mother was getting ready to take the child for their first visit, and the father thought it was appropriate to show a bunch of YouTube videos of dental visits gone wrong.
No.
That is definitely not. I don't know how that happened, but another mother suggested that there's actually an episode of Molly of Denali where she is coping with fear of the dentist, and so that might be something good to show. Should your
Yeah.
child be afraid of the dentist? It's a pretty good show.
Yes, I agree with going the more positive route negative videos on YouTube. Just, uh, yeah, want to make it a
Yeah.
positive experience.
It should be a positive experience for everyone. I find that with parenting, a lot of times we are nervous about certain things and
Mhm.
then we get our kids involved and it gets worse for us. And they're okay, they're resilient, but we've got all this history behind us and we get nervous. And I think that applies to dental
Exactly.
visits, that a lot of times it's much more nerve-wracking for the parent as opposed to the child. So it's good to do that early. So you said first tooth or first birthday.
Mhm.
And I didn't have that information with my twins. They're now 7, and I took them at the age of 2. And the pediatric dentist identified tongue ties in both of them that had been ignored. They were brought up by our lactation consultant and ignored by the
Mhm.
pediatrician. The pediatric dentist, actually, the one we use, is trained in that, and so she was able to handle
That's
that.
great.
And because we knew that there was a genetic component to that in our family, when my little guy was born, I took him to the pediatric dentist when he was a week old, and he was diagnosed with both lip and tongue tie, which were handled at 2 weeks old. So there are different reasons to bring them
Mhm.
earlier. Yeah, it sounds like a sad
Absolutely.
story, but I actually did a nap time nutrition on tongue and lip tie, and it's gotten a lot of use because this is an increasing issue.
It is. It is. And definitely, I think that's one place where pediatric dentists can work as part of a team with lactation consultants, with pediatricians, with speech language pathologists. I mean, a whole team to really help resolve, lip and tongue ties to help with function. And so, yes, that is a reason to definitely come and see us early. A couple weeks ago, I had I think they were 1 or 2 weeks old, come in for an exam. And I'm like, this is perfect. Like, I'm glad that parents feel comfortable coming in and having, these exams and getting things looked at very early so that, we can address them early.
Yeah, it's really helpful. And last week I interviewed Jimmy Yella Lease on infant massage, and the subject of tongue and lip tie came up with that as well. And he was giving some specific ideas on what you can do with an infant who has had a lip or tongue tie revision to help
Mhm.
to heal from some of the restrictions they may have in the
Yeah.
musculature. So that's
Yes,
been
very,
interesting.
very important. Hmm.
Yeah,
That's great.
yeah. Okay, so how often should kids be brushing their teeth?
So we recommend 2 times a day, and this is something that I kind of work with parents and children a lot on finding a good time to brush and finding a routine that works for them. Definitely the most important time to brush, I would say, is at nighttime before, we go to sleep. The reason being our salivary flow decreases overnight. So if we have residual food and plaque and things on the teeth, that salivary flow throughout the day helps to kind of wash all that away. So we want to brush that off before we go to bed. In the morning, we want to wake up and either eat before or eat after we brush our teeth. There's really no hard and fast guidelines about that. If you want to brush before you eat, you can. If you want to brush after you eat, you can. But the main one that's super important is at night, and just trying to find those times with parents that work, for their schedule, and work for kids for their schedule. With older kids, we talk a lot about, they're staying up late, and with little ones, brush, book, bed, maybe making a routine out of it. So just working with each parent and each family to find the right time to brush, knowing that we want to hit those 2 times, but for each family, when we hit those times may look a little different.
So it's kind of like, when's the best time to work out? The time when you're
Yeah,
going to do it.
right. Exactly.
Yeah.
Exactly.
And is there anything that parents should look for specifically in a toothbrush or in a toothpaste?
Sure. So I like to think about, before we have teeth, when a lot of kids will get their teeth around 6 months age. Some kids are before that, some kids are after that. It's all kind of on a bell curve of normal. But when we just have the gums there, it's important to get little ones used to that feeling of, cleaning their mouth, cleaning their gums, and removing food and debris and things like that. So you can use a clean washcloth, or you can use what's called a little finger cot or a finger brush that just goes over your finger, or you can use a clean finger to do that. Once teeth start coming in, you can still use the little finger toothbrush to get kind of those 2 little teeth that'll start to come in on the bottom. But as more and more teeth come in, you can look for a toothbrush that has a small brush head, and it has soft bristles. Even for adult teeth, we recommend a soft bristle toothbrush, because like hard bristle brushes can actually damage the enamel. So always look for a soft bristle, no matter if you're a child or an adult. Um, and so we want to look for that. And then For little ones, if they want to try like play brush, a thicker brush handle just for gripping to make that a little bit easier. And then for toothpaste, we talk a lot about fluoride toothpaste and the right amount of, if we're going to use fluoride toothpaste, how much to use, and toothpaste in general. If we're under the age of 3, we recommend like a smear size. So like a very, very small amount. I always tell parents, if you have a travel size toothpaste, that should last you a long time with how much you need to use. And children over 3 recommend like a pea size. So just kind of ways to think about that because we don't want to use too much toothpaste. But I would say those are kind of the biggest things to look for.
Thanks, that's really helpful. And I know this wasn't on our outline that we discussed, but what is an appropriate age range to expect kids to be more independent with adequately brushing their teeth?
Sure. So, we talk about around maybe age 7 or 8, but honestly, I would say it depends on each child. Some kids, I think for hand skills, I would say at least around age 7, 8 is when we can start to explore it. A lot of parents will, when their children are getting older, will maybe let their child brush on their own in the morning. And then at nighttime, we'll take a look and we'll help them brush and just check and make sure everything looks good. But I would say that's kind of an individual decision. What I usually like to tell parents is, we'll check and we'll see if there's still a lot of plaque. Would still recommend parents at least supervising sometimes or helping, or if they notice that there's an area where the gums look red or puffy, to maybe get in there and demonstrate how to brush. But usually around age 7 and 8 is when we start to kind of think about having a lot more autonomy and independence with brushing, just for dexterity and hand skills, and then just kind of personal responsibility and getting children ready for those next steps.
I think that's a great way to look at it, and it builds up their confidence and builds up their
Mhm.
responsibility. And kids do so well with responsibility, and that's why my big platform is cooking with kids. And
Okay.
it's amazing how these themes just repeat themselves with seemingly unrelated topics. I mean,
Mhm.
being independent with brushing their teeth has something in common with being independent with
Right.
chopping carrots.
I do. I
Who would
like
have
that.
known?
Yes.
Yeah, yeah, that's great. So when should kids begin to floss?
So that will also depend on each individual child. Some children have a lot of spacing in between their teeth, and so the toothbrush can reach all of those areas perfectly fine. And for some children, their teeth are tight. I talk about with kids, your teeth are just best friends, just so tight together. And so for those children where their teeth are tight together and we can't see in between, would recommend flossing there because, I tell them all the time, the toothbrush, it would be great if the toothbrush could fit in between the teeth, but it can't. So that's why we use floss to help us get those areas in between. So I would say it depends. Usually around age 4 or 5, those back contacts tend to close, but again, that varies for each child. Some children, when the 2 front teeth come in, they're tight together, and then as the rest of the teeth come in, they're also tight together. So the pediatric dentist or dentist will definitely let you know when it's time to start. And if you see it at home, you can certainly start with the flossing.
That's really helpful. Yeah, and it really does depend on the child and how their teeth are. My kids
Mhm.
in the front are pretty far apart, and then the back they're pretty tight. That totally makes sense. Okay. So what can parents do if kids are resistant to brushing or flossing?
Sure. So I think there's a natural inclination for children. A lot of parents, we talk about, my child was really good at age 1 with letting me brush. It was wonderful. And now that they're 2, 3, they don't want me to brush. They don't want to do anything with me at all. So I think there's a natural interest for children to want that independence and to have that independence, even though they may not necessarily have the skills to be fully on their own. So a couple of things that I suggest is, it may be, no matter what you do, at first and foremost, I tell parents it may be a little bit of a struggle no matter what you do. But the goal is we want children to have healthy oral health. But some things that I find helpful are laying little ones down and having it be a 2-person activity if possible, where one parent maybe helps distract with a game or singing a song or waving the hands back and forth and the other brushes. If we're solo, I find having the child sit on your lap and kind of resting their head in your arm, that can also be helpful. Singing, counting, if we have a favorite song that we love, letting them brush their teeth either before or after. playing dentist, then, you can brush mommy or daddy's teeth after or before, letting them have that experience and that autonomy, and then taking turns. Or sometimes I have one patient that likes to brush she has a little teddy bear, likes to brush her teeth, and then they brush. And then also having a routine. I feel like, for a lot of parents, creating a routine where we have a set as much as possible um, is helpful as well. So those are a bunch of things that can be helpful. And sometimes we do all of that and it's still a struggle. So I just tell parents, keep trying your best. It does get better. Eventually, it may take a little bit of time. But the goal is to, get in there and brush, and eventually, hopefully the child will become used to the routine and the habit and will be more accepting of it. But initially it can be a struggle. It can definitely be a struggle.
Yeah, when I talk about picky eating, I talk about the different points of the day when kids offer a struggle, and toothbrushing is always on that list. It's
Yeah.
it's getting dressed, it's getting showered, it's going to bed,
Mhm.
it's eating. Any point where the child could potentially clamp their mouth shut, look away, and say, "Nope, I'm in charge and I'm not doing this." And so
Mhm.
the way when we're talking about selective eating, the way that we go about that is to make it fun and get the kid involved and give the kid
Mhm.
some personal responsibility. So I
Yes.
love when you said taking turns and allowing the child to brush the parents' teeth or using a favorite character. These are
Mhm.
these are similar to pieces of advice that I would give at the table if you're having trouble at the table as well. And I know my little guy who's 4 now, he has his turn brushing his teeth and then it's mommy's turn. And so
Good.
that's what we take. And I think also if we allow kids to maybe pick out their own toothbrush,
Yes.
and especially right now, we're filming this during lockdown. We're not going to take the kids to Target and have them touch
Right.
everything, but you can certainly scroll on Amazon
Mhm.
or any of your favorite websites to pick out the
Yeah.
soft bristled toothbrush and maybe a toothpaste too,
Yeah.
just something that's appropriate. And so we talked about what to look for in a toothbrush. So what do we look for in a toothpaste? I know this can be a very controversial thing because people have lots of different ideas on what they want and don't want in their
Yes.
toothpaste.
Yes. So, and this is a common conversation that we have. So I try to support parents either way in what their decision is, because ultimately I feel my role pretty much as a pediatric dentist is to give them, information, try to tailor that information to them and their child, knowing each family is unique and kind of want to make the best decision, of course, for their child. And we work as a team to do that. So what I would say, and I'll give a couple different versions of that, is I do talk about fluoride toothpaste, and I do feel that it is beneficial. And we'll talk about reasons for that in terms of remineralization and, helping to support, tooth, remineralization, removing plaque and things like that. So to look for a toothpaste with fluoride in it, if we're going to do that, then we want to look for one that contains fluoride. You don't need a prescription or anything like that. You can start using it when the teeth start to come in with a smear size. Some parents will want to wait till their child's a little bit older and can spit and has that reflex to start using it. And if that's the case, I'm okay with that as well. If we don't want to use a toothpaste with fluoride, then I talk about, and I'm interested in looking into more research in this, which is, I feel like dental research is, all different kinds of things that you can get into a lot, but there's a lot of interest now in toothpaste with what's called hydroxyapatite, which is actually a building block of the tooth. So there's a toothpaste called Risewell that has that ingredient in it. And so their thought is that it doesn't have fluoride, it has hydroxyapatite. And their thought is by introducing a product that's, used to build the teeth, that's a helpful way to get remineralization as well. So I'm very interested in the research in that and how in the future that can be used more and more. I would say if parents are comfortable with that as well. There's also been studies with toothpaste with xylitol in it. And so a lot of toothpaste that don't have fluoride will have xylitol in it. There is some research that is helpful, but it takes a lot of xylitol to have an effect. So that one I'm not as much a proponent of, just because it takes a lot of xylitol to have the effect. But hydroxyapatite is a natural ingredient that I think in the future can have a lot of really interesting and neat benefits in dentistry. So I'm interested to see how that kind of comes to fruition. And then fluoride is that's something that I talk about, daily with my patients. But I try to support parents, kind of however they feel comfortable. I don't definitely want to force a parent to use fluoride just because I think that, that's what I would use. So I try to see kind of what parents think and what their questions are and kind of go from there. Sorry, that was kind of a long-winded way to get back to the answer.
No, I think that's great because you addressed the main controversy, and it's parents need to feel that parents need to feel confident and comfortable talking to their healthcare provider about these questions because we see a
Mhm.
whole lot on the news, we see a whole lot on social media, and it's
Right,
best that we see our healthcare professionals as the
right,
experts and have conversations about it.
right.
And if we have concerns, we should be able to express that to the pediatrician, to the dietitian, to the dentist,
I agree.
so to have that conversation, and
Mhm.
if parents don't feel comfortable, then it might be time to look for a new healthcare provider with whom you can feel comfortable having these
Right.
conversations.
I
It's
agree.
it's it's so important to feel confident.
And I don't ever want parents to feel like I'm, shaming them or like judging them. I don't ever want that to be a part of the conversation. So I think it's important, especially as a healthcare provider and as a parent or caregiver or anyone, who participates in any type of healthcare system to feel comfortable and like you can talk to your healthcare provider. So I definitely agree with you for sure. I think
Yeah.
that's very important.
Okay, so let's get to the crux of this. Okay, does sugar contribute to cavities, and is it to the extent that we have been told?
So I would say the cavities process has a lot of very different factors. Of course, we talk about diet, but another important factor that I think we need to consider is the bacterial, content that's in our mouth and it's in our microbiome because you can, and it's interesting in families, like I'm one of four, and we all ate the same diet, we all did the same things. Three of my sisters, myself included, had didn't really have a high cavity experience and my other sister did. And so, we ate sugar, we ate, all different kinds of foods, and that was still our experience. And I find that, while diet plays a part, I think another issue to look at is, bacterial buildups. There's just some patients that unfortunately have a higher bacterial load of the cavity causing bacteria. So they're ultimately higher predisposed, even if they're, limiting sugar as much as they can, brushing, flossing, doing all that, they're still at that higher risk. So I think looking at each patient's individual risk factor, to me, is a more accurate picture of, who's going to get cavities than are they eating, sugar all times of the day. With that being said, of course, we want a healthy diet and things like that, and that's part of the conversation. But I don't necessarily, harp on that as much as let's look at the entire patient and then go from there rather than focusing on that one issue, which is sugar intake, and that's the whole conversation.
Yeah, so you brought up something that I just really want to highlight. It's the microbiome in the mouth. And the microbiome in the intestines it's gotten a whole lot of attention in the media
Mhm.
in the past, I don't know, 5 years or so ish. And it's fascinating to study what's going on in the gut and how it impacts our feelings and our emotions, and then our energy and our health status and medical issues overall. It's got impact all across the board. And we have just started as a society to recognize the importance of having a variety of different bacteria in the gut. I mean, and we're talking like your average probiotic supplement has two or three different species or strains in it.
Mhm.
A strong one, the ones that I recognize have, or the ones that I encourage, have about 12 to 14 different species and strains in them. But your gut has at least 10,000 different species and strains going on there. And by the time that was out of my mouth, it's probably outdated. But we have something similar going on in the mouth, and that's going to impact your oral health.
It's
And
true.
it'll have some interplay with diet, but it's got a genetic component, it has a dietary component, it's got all kinds of different factors, and that
Exactly.
impacts your cavity experience as well.
It does. It does. So I definitely, look at diet, but I also look at brushing routines, habits, parents' cavity experience. All of that I think plays a role. The other thing I would say is necessarily like sugary foods, it's all kind of about once the bacteria has whatever plaque source it has or food debris it has, breaks it down into acid. So really, the issue that we're fighting against is trying to prevent the bacteria from breaking down our food particles into acid, because the acid they produce is what breaks down the two. So it's not necessarily, sugar alone that does that. There's a lot of other different foods that can do that as well. So that's another important point that I think, we want to prevent acid attack on our teeth. And so how can we do that, and what can we do at home, and what can we help as dentists do for our patients?
Right. And I think that's so fascinating that it's not the sugar on the tooth that causes the cavity. It's how the sugar is digested by the bacterial population in the mouth that produces acid that causes that cavity. So there's just so much at play there. And I, I've always been kind of really geeky with these bacterial strains, which is why I'm kind of giddy talking about this. I make my own yogurt, not because it's healthier, just
That's
because,
neat.
yeah, just because I'm
That's
that
really
like,
cool.
I'm that geeky about these strains, and I like messing with the different strains and see what happens. So knowing that this is going on not only in the intestines but in the mouth, I don't know, it seems to really rev my engine.
It is. I mean, it's fascinating to think about, how bacteria plays such an important role kind of in our lives. And like you were saying about gut health, like it seems like it just kind of touches all the other areas. And I feel like your mouth is a huge part of overall health. And so it's important to think about it as, how does my mouth and what I'm doing with my teeth and my gums and everything, how does that affect the rest of my body and my overall health?
Right. And while you're bringing that up, we did touch on that in when I was studying to be a dietitian, on how oral health can contribute to cardiovascular health. And
Hmm.
it's not an expected link. I mean, it's not like you're thinking, if I don't brush my teeth well, I'm going to have heart trouble, but there is a
Right.
link there. And there is a link between good oral hygiene and maintaining a pregnancy full term. It's
Hmm.
really fascinating how oral health contributes to other factors of health that you wouldn't necessarily link.
That's, yes, it's so true. And I feel like, I don't know why I feel this way, but in talking to even my own family, it seems like the mouth is kind of separate from everywhere else. But I think it's important to try to meet them up in the middle and say it's all kind of one thing. So that's exactly a perfect link, is heart health and pregnancy health throughout having a healthy pregnancy for both mom and baby, I think is a very critical one that we as pediatric dentists kind of think about a lot.
Right. We think, and as the speaking from the public perspective, we think about taking prenatals. We think about including more fruits and vegetables. We think about healthy exercise and pre-pregnancy yoga, and we don't necessarily think about how flossing can help
Right.
maintain a healthy pregnancy. But there is a substantial link. There's a lot of evidence,
Hmm.
peer reviewed, et cetera, not sponsored by Crest or whatever. Yeah. Okay, so what is the number one piece of advice that you want parents to know?
I would say to, you know your child best. So I would say work with your pediatric dentist on a plan tailored to your child in terms of home care, and don't be afraid to ask questions. Find a routine that works for you. I think I talk a lot with parents about, what's routine's going to work for them, what's going to be best for them, what kind of products to use and how. And I think just really thinking about your oral health and your child's oral health as being tailored to them, and not like one size fits all. Like, I have to have this toothbrush, or I have to have this toothpaste, or I have to limit this for my child to have good oral health. But like, what makes sense with your family? What makes sense for your child? What's going to work, and what's going to work so that you can do it, and you can do it successfully. So I think just finding a provider that can do that for you, and then knowing that you know your child best, and working on a routine that works best for them to have that good oral health, and to continue to see a provider that helps you as part of that team.
I think that's amazing. And you're in Maryland. I love to plug my doctor over here. I'm in Chandler, Arizona, and she's in Gilbert, Dr. Catherine Cotton, and she's wonderful. I've spoken to her about some of these concepts as well. But please tell our audience where they can find you.
Sure. So I am usually over on Instagram. I'm trying to use my phone less in 2021, but with
Me too.
2020 so far. But you can find me on smallteeth_big world. And I'm always happy to connect with people and, share evidence-based information and things like that, to be a place where you can feel comfortable coming in and chatting and engaging.
That's fantastic. There are so many questions out there, and it's great for parents to have resources that are responsible and reliable. And one of the big pieces of advice I give parents who are struggling is to make sure your social media is filled with people who are experts in their field and can give responsible advice to benefit you and your family, both in confidence and in science.
I definitely agree with that. There's a lot of, unfortunately, misinformation and things out there. And so always consider the source. And sometimes it's hard to tell what the source is. Everything can look very legit, unfortunately. So yes, I agree with you wholeheartedly. Very,
Yeah.
very, very good advice.
Well, wonderful. Everyone should go find Jordan on Instagram. Thank you so much for joining me. And right now
Thank
it
you.
is December 30th of 2020. We
We
have
made it.
we have almost made it.
Yeah. Yeah.
So here's my coffee. Cheers to 2021 being a little bit easier on everyone. We both have red
Yeah.
mugs.
Cheers. Oh yeah, that's
Cheers.
cool. Nice. Oh yeah.
Russian tradition. You gotta sip. All right, thank you so much for joining me, and I will
Thank
see you
you.
on the flip side.
Yeah.
Everyone, I would love to tell you when the next nap time nutrition is, but I am flying by the seat of my pants at this point. So check out the YouTube station and the podcast. Check out naptimenutrition.com, and I will get to you when I can get to you. I would love to have some of your questions. So thank you so much, and
Thank
see you on
you.
the other side.
Bye. Take care.
Bye.
That was fun.
It might still be recording. I'm not
Oh,
sure. It took a while to start. It might take a while to stop. I don't know.
well, alrighty then. That's okay.
We could just be making a bloopers reel at the moment. I don't
That's true. That's true. We're just making it an already attached bloopers reel. That's fun.
well, it's like 2020, the bloopers reel.
Yes. Pretty much. Oh, it says true.
It said request failed. It doesn't want us to stop filming.
No, it was like, this is fun. Keep going. Keep recording. No, this is great. This is nice for parents to be able to see a bunch of topics. This is awesome that you do this. I was
Thanks.
actually
Yeah.
Oh, go ahead. Sorry.
Oh, I've got over 170 videos on YouTube now, and
Oh,
I
wow.
I really enjoy doing this.
Mhm.
I like being a resource, and I like highlighting professionals who can be resources, who are reliable and responsible.
It is so important. Some of the stuff I see online, it's like, this is the Wild West out here. It's
It,
crazy.
it
But then,
really won't let me stop filming.
it's well, they just said enough.
It's just, yeah, the program just really likes us.
That's so funny. Oh my,
This is hysterical. That's never happened before. Okay, I'm gonna close out of the screen so I can go play in the snow. But
have fun in the snow. That'll
thank
be
you, thank you so
fun.
much for joining me.
Sure.
And
Thank you for having me. This was fun. This was great.
yeah,
Thank
Happy New
you.
Year.
Yes, Happy New Year. Happy 2021. Fingers crossed.
Yeah, we can do it.
Yeah. Yeah.
Thanks.
Take
Bye.
care. Bye.
Okay, it finally stopped.
Okay, now it's just